The Alzheimer's Association is partnering with the American College of Radiology to enroll about 20,000 patients ages 65 and older into the IDEA study over 2 years. Carilion Clinic is one of 200 sites throughout the United States participating. 85-year-old Richard Kidd is one of the patients participating in the IDEA study, which may allow healthcare to provide targeted treatments for Alzheimer's disease and other forms of dementia. Joyce, Richard's wife of 60 years, hopes the study can help find answers for people like her husband.
Every once in a while she said, "Richard, you're not like you used to be. Why?" "No, I'm not. And I don't have an answer for the why." And whatever they find out about me might help somebody else.
Helping others has always been part of Richard's life. A Marine who fought in the Korean War, a father, and now a grandfather, he hopes to learn more about what the future might hold.
Up until a couple of years ago, I had a great memory. My memory today, if I had it on the market to sell, it wouldn't be about 2 cents.
Richard is prepped for the same PET scan all participants go through. Doctors are looking for amyloid plaque buildup in the brains of study participants.
The way amyloid PET works is that it actually labels and tracks one of the proteins that we think is intrinsic to the disease process with Alzheimer's disease.
Well, there's an abnormality that occurs in people with Alzheimer's disease that the tracer that is used in these PET scans highlight. So the PET scans will tell us that information.
At Carilion Clinic, Dr. Ferrara and Dr. Knight, along with several others, have been instrumental in bringing the IDEA study to Roanoke. And they work closely with Virginia Tech Carilion School of Medicine students. The partnership allows students to identify ways to diagnose complicated conditions related to the brain's function and aging.
If you have a negative scan, there's almost no chance that you will have Alzheimer's disease. But if you have a positive scan, it means you could have Alzheimer's disease, but as we get older, we all deposit a little bit of this protein in our brain. So it gets less specific as you get older.
And that part about getting older explains why Richard's scan is somewhat inconclusive.
I know what's down the road when you look at Alzheimer's, unless there is a cure somewhere along the way. It's nothing pretty.
While this scan showed some level of amyloid plaque, Dr. Wood doesn't believe it is extensive enough to indicate an Alzheimer's diagnosis.
It's great to be on the cutting edge of research and the technology that's out there, and especially going forward with the upcoming treatments that may be coming available. Having this tool already in place will allow us to be closer to that next step.
For Carilion, since research is one of our core missions, it's extremely exciting, and one of the unique aspects of the IDEA's trial is that it incorporates the physicians as subjects as well as the patients. So we're not just looking at the diagnosis of the condition, we're also looking at the way that clinicians interact with patients and how they select therapy.
The IDEA study, one more step in a direction for more targeted dementia care. Karen McNew for Carilion Clinic.